Hi again, I'm back. So trying to find Dr. Shan, and I'm going to invite him once again. Hi everyone, back on live from Toronto. Hi, just let me know if you can hear me. If you wave or yes, that's good. If you can hear me, I'm going to invite Dr. Shan. There we go. Okay. As usual, some technical problems. Dr. Shan, I can see you and I sent you an invite. Hi, do you see me? And I sent you an invite so you can accept the invite and join us. There we go. I sent you another invite.
Okay. Hear me okay?
Hello, hello. Hi, finally.
Yeah.
Great. Lovely to be with you here. Privileged
Yeah.
to be with
Sorry
you
about
here
the
today.
Instagram hiccup. I've never had that happen before.
That's
So,
okay. Lovely. Dr. Shan Omara, lovely to have you here. A true pioneer in reversing chronic disease through lifestyle and imaging insights. So it's great. Let us know a little bit about yourself.
sure. So I specialize in health and performance optimization right now, but I'm formally trained in emergency medicine. So I got a scholarship through medical school and served in the Army and military scholarship. And just recently actually retired as a full bird colonel after over 20 years of military service in my country. And during that time, I got to provide medical care and physician coverage to President Clinton, Vice President Cheney, President Bush, secretaries of state. So I had a lot of experience doing like high level medicine. And then I got some experience doing concierge medicine as well. But it wasn't until about 2013 that I actually started specializing in health optimization. And it's because I got myself, like every American, with so many people, I was overweight. I had medical problems. I had a large problem.
We don't have your voice, your sound. Can't hear you.
Oh, hello. Check one,
Yeah, it's
two.
better now. I
Okay.
have you.
Okay. Yeah, not sure what happened, but so yeah, I had a lot of medical problems and I changed my lifestyle and thought, just to I would lose weight, but all my medical conditions reversed. And so I met a researcher that we shared a passion for studying how to really get healthy. And we decided we target chronic disease and specifically look at a area of fat that he found out, which is this fat deep in the abdomen and fat that surrounds your heart and fat that fills your muscles. So we applied for a grant from the National Science Foundation and studied those three areas of fat inside the body in thousands and thousands of people, and we learned how to get rid of that fat studying what happens in nature. So we didn't we didn't go out and look at medical science like studies. We went right to where everything is fantastic out in nature, and we tested what animals do in the wild. You know, they barely exercise. When they exercise, it's like life and death, very intense. They eat no processed foods, so we switch people to just natural food like you might eat in the wild, and then we maximize sleep, exposure to light, and yeah, all these natural strategies that the animals do. Who would have known it gets rid of disease? So I studied it for 7 years, really volunteered for 7 years for the National Science Foundation. Never took a penny. My research partner and I were completely unpaid. We volunteered full time. So I'm not bragging about that, but I'm adding, I share that with people so that they know that I am genuinely, authentically, somebody that understands just how important this is to give up 7 years of my life full time volunteering to study this dangerous fat. And now I work with private individuals who are mostly C-levels of companies. We found out during for the National Science Foundation that people that got the best results were people that had livelihoods connected to performance. So we study a lot of law enforcement, firefighters, military. We could get them real healthy, but they never made more money as a result. So they were less motivated to do the strategies and get rid of the fat than business executives that would be bonused, like salespeople or CEOs, COOs, people that get more money if they perform better, they would do the strategies more. So now I just target those people because I'm trying to get the very best results in the world. And so now I work with mostly executives of companies, high performers, people that if they perform better will make more money. And I leverage that motivation to get rid of this dangerous fat around the heart and fat in the abdomen. So everybody can, it's pretty much the same. They can get rid of it. It's just that people, you got to have a motivation. And for most people, at least in the United States, most Americans are not terribly motivated unless you pay them. And so we leverage that particular aspect to their vocation, and we get them performing way better. They make more money. They look better. They become better influencers. So that's my background, how I got started doing this.
Amazing. Great. In your work, you emphasize on primitive living principles. What are those? You mentioned a little bit about those and how a modern patient can apply them in daily life.
Yeah. So I got this behind me. I put this. I start out, shows and
Yeah.
podcasts I do with my logo, and so these are the basic principles I use: eating meat, eating fermented food, getting sunshine, getting into a sauna, so heat, and cold plunging, and then do sprinting and maximum intensive exercise. So those things are really life changing. And if you do them, you'll eradicate disease to the extent that you do them correctly and properly. So those are the kind of basic, you could call them primitive. They're fundamental. I think they've been fundamental to our lifestyles for a long period of time, and they're key to our species always improving. So if you look vocationally at what we've done for most of our existence, it's been hunting. So
Mhm.
we've been mostly hunters, and today people still hunt, but they hunt money. Their
Mhm.
compensation isn't a piece of meat now. Their compensation is money, and so the better our ancestors were at hunting, the better they lived, and the longer they lived. So if you were really bad at hunting, you couldn't get as much meat, you couldn't survive, and you couldn't thrive. So we get back to the primitive, basic fundamentals. that I recommend for people to do. I've incorporated them into my logo to help highlight that, and then I work one on one with people to understand those strategies, and I scan them. I do MRIs and show them dangerous fat around the heart that almost nobody knows about. Its technical term is called epicardial adipose tissue. It's really visceral fat that surrounds the heart in your chest, and then the dangerous fat inside the abdomen, visceral fat. I show them, scan them through their abdomens. And by the way, Dr. Bahar, you no doubt have seen abdominal CTs, and you can go back in your patients and just start looking at how much visceral fat your patients have inside their abdomen, and then correlate it to their diagnoses. The longer they've had that fat, the more medical problems they have. Mm-hmm. And the more you get rid of it, the more you'll reverse those medical conditions. It's that simple. So I advocate across the globe, every country should adopt a policy of no longer following cholesterol, but following this dangerous fat that's around your heart and dangerous fat inside your abdomen that absolutely correlates to not only disease, but including the deadly forms of disease, heart attacks and strokes. There are many people that have super high cholesterol and live super healthy, super long lives. But there's nobody, nobody who has lots of visceral fat and heart fat and lives a long, good life. Nobody. So that's what we need to get out. We need to let people know this dangerous fat is inside your heart and around your heart, inside your abdomen, and it completely interferes with your quality of life. Don't complain about your health and the quality of your life if you've done nothing about that heart fat and visceral fat.
I totally agree. So for those who don't know, this visceral fat is a fat deep inside our body, around our organs that produce some inflammatory cytokines, some markers, some inflammation, and that's a dangerous fat. Yeah, we can see it there, and it's very different from subcute fat. So if you could let us know a little bit about this fat and what's the difference.
Yeah, it's great. So this is just so the audience understands what we're looking at in case somebody's listening to this and not seeing it. We're looking at a MRI scan of somebody laying on their back. So this is their back, and this is their belly button. So you got air in your belly button, and they're looking up at the ceiling while they're laying in the back, going through an MRI scanner. And this is a pretty typical view of a that we like to do. And fat on an MRI scan shows up as white. So wherever you see this white, it's fat inside a human being. And there's really three types of fat we can see here. One is visceral fat, and visceral just means the organs. So it's fat around your organs, inside your abdominal cavity, surrounding your colon, your small intestine, your abdominal content. And then the other type of fat we see here, muscles show up as dark. So the muscles in like your abdominis rectus, your six pack, are visible right here, and your oblique muscles. And you can see all these white streaks in your dark muscles. That's fat that's starting to replace your muscle and marbleize your muscle. And even though the average consumer thinks like marbleized steak is good, it's a diseased cow. It's disease in a human being. It's disease in a cow. So you don't want to have marbleized muscle. You want muscle that's pure and lean and looks, really healthy. So an example, by way of a contrast between a scan that is good and bad can be seen. This is the same one we were just looking at, but see how big this guy's muscles are. They're big and they're lean. They don't have any of the fat streaks in them. And so his legs are also very lean. See how dark his muscles are? but this guy's legs are filled with fat because he's got all this fat inside your abdomen. So if you got a lot of visceral fat, you're going to have a lot of fat in your muscle. And heads up, if you're listening to Dr. Bahar and I talk right now, you you know this without being told in medical school. If your leg muscles are filling with fat like this, how can they work as well as this guy's? This guy had to take 2 swings to get up out of a couch. This guy is an Olympic sprinter. You want legs like this without fat in them. You don't want legs riddled with fat. And the single reason you're going to need a cane and a walker and eventually a wheelchair and eventually just a bed, because you won't even be able to hold yourself up anymore in a wheelchair, is because your muscles get replaced with fat. And no doctor knows about this. Nobody. It's not taught in medical school. It's being kept out of medical school. Did you learn it, Dr. Bahar? Anybody tell you, young doctor, you need to watch for this dangerous fat growing in muscle, this dangerous fat inside the abdomen, and also this dangerous fat that surrounds the heart. So look at its connection to hearts. So here's here's a pic. Well, let me get a blow that up a little bit.
I mean, we're still in this day and age looking to weight and BMI. Those are the markers
Yeah,
we still use in the, which is not, I mean, I'm sure that you can explain more about that. We
yeah,
have to
I
look
can.
into
So
visceral fat.
it's BMI is taught in medical school because it's safe and easy to do, and it's ineffective. It doesn't get anybody better. Things in medical school that would cure people are not shared. We don't let that go into the curriculum in medical schools because it would undermine the system's ability to make money through us. We're just pawns. We're pieces on the chessboard. That's all we are. But this is the right lung, the left lung, and this is the heart right in the middle of the lungs. And all that is a huge amount of fat choking off and constricting. Dr. Bahar, how does the mechanical operation of that heart exist when it's got that big chunk of fat around it? Nobody talks about it. People walking up the steps getting short of breath, they just think they're out of shape. No, you've
Mhm.
got fat choking off your heart. That's what's going on. This big chunk. This guy was in his early 50s and dropped and had a heart attack suddenly. And then, fortunately, he survived and was able to come to me and get rid of that heart fat. But this is the shocking reality that's happening to people. And I'll give you an example just so your viewers can understand the way how fast this can go away. This is a person who came to me as a professional football player in our country, filled with this visceral fat, and he had lots of fat in his muscles too. But look how much he reduced that in about a year. He eliminated all that fat in a very short period of time, and also his big chunk of fat. Look how much fat he had around his heart. I'll just blow it up so it's a little bit bigger. So this was his heart, big chunk of fat, and then his heart. After 1 year of working on that, of eliminating it. So it becomes, boy, it's hard to get that down there for some reason. Maybe if I do it, there you go. So you can see a tremendous reduction, but also his legs, all that fat that he had in his legs, that a former football player, and look how much he cleaned up his legs during that period of time, and look at the change in his face, how inflammatory this fat is in your adjuvant also inflames the muscles in your face. There are lots of muscles in your face to do facial expressions, to masticate, to chew, and all the things, turn your eyes and things that you have to do with your face and head. And look how much he improved that face in just 1 year. This was definitely 1 year time between these photographs. The scans actually were closer to a year and a half, but the facial photograph was just 1 year. So the other thing you asked about, and it's important to distinguish, is the difference between this deadly inflammatory fat in the abdomen and subcutaneous fat.
Mm-hmm.
So subcutaneous fat is fat just below the cutaneous structures, your skin. So it's this fat here outside the body. So this fat is the worst fat in your muscle. And do you see this black line here? That's a fascia membrane called Scarpa's fascia. And Scarpa's fascia separates the subcutaneous fat into two compartments. So there's two compartments. They didn't teach us this in medical school either. Superficial subcutaneous fat and deep subcutaneous fat. So superficial subcutaneous fat is the superficial kind, from the skin to the membrane. See how small it is? And from the membrane to the deep muscles is called deep subcutaneous fat. And if you can see how it's got a different characteristic. This is really white, and this is kind of like non-homogenized, heterogeneous. And this is more homogeneous. So
Mm-hmm.
it's
Mm-hmm.
got a different appearance because biochemically it's different. This one behaves like this fat and this fat. It has adipokines, cytokines, and these inflammatory molecules, tumor necrosis factor alpha, interleukins that get released and cause disease, inflammation throughout the body. So this stuff, one, two, three, produce disease. And this one, believe it or not, doesn't release those inflammatory molecules like the other three do. It
Mm-hmm.
releases a molecule called adiponectin. And adiponectin is really, really beneficial. It actually protects you from disease. It protects you against heart attacks, strokes, neurodegenerative conditions like Parkinson's and MS, and all these diseases that the medical system makes so much money off of. And ladies, if you're listening today, don't ever get liposuction trying to get, the fat removed from your abdomen, because that's where adiponectin is in that superficial subcutaneous fat. And many women have messaged me when they got liposuction that it changed their appearance of their face. They didn't do anything to their face. They just got rid of that fat. And that fat not only makes you healthy, but it keeps your face attractive and pretty. And women lose their adiponectin because they start switching their subcutaneous fat for visceral fat at menopause. And so I like to use the term the ugly button gets pushed
Mm-hmm.
at menopause, because women start putting on visceral fats and they're no longer creating the estrogen that they get from their ovaries, and they lose their estrogen conversion from subcutaneous fat at menopause, and so they end up doing hormonal replacement therapy because their female reproductive system isn't working anymore, and then they buy the lie that was bought by the males, and the males bought the lie that you want to see a six pack. Guys and gals, you do not want to see a six pack except on an MRI. That's the only place you want to see a six pack. You want to have a thin layer of superficial subcutaneous fat on your body so that you have adiponectin. adiponectin. Write it down. Go to Google,
Mm-hmm.
study it, ask AI about it, how protective it is, and it comes from superficial subcutaneous fat. So there's good fat and bad fat. And once you figure those out, you will optimize your health for the rest of your life. And until you do that, you're at the mercy of the healthcare system that you're just going to fall apart and make more and more money from them and go on more and more medicines.
Yes, I call it sick care
Yeah,
system, not a
exactly.
healthcare. So how people end up with that deep visceral fat, and how can we diagnose or measure it? That's the main question for people who are hearing us today.
Yeah. So the best way to diagnose it and measure it is actually to visualize it on abdominal MRI scan. An MRI doesn't use any radiation. It just uses safe magnetic fields. A CT scan uses radiation, but it will show it and actually show it quite well. It's just an inverted coloration in a CT scan. So I'll show a quick CT scan so you can see it and your viewing audience, because many women, at least in the United States, have undergone CT evaluation and have had a CT scan in their life. And so CT scans will show visceral fat. It just shows it in reverse coloration, so it comes
Mhm.
up as dark instead of white. Visceral fat is, I must have gone right by it. Sorry. Visceral fat is black on a CT scan. So versus it is white on a
Mhm.
there it is on an MRI scan. So you can see all this black is visceral fat. The muscles are white on a CT scan, and
Mhm.
you can still see scarpous membrane and see that big deep subcutaneous fat and the small amount of excuse me, superficial subcutaneous fat. So CT scan is the second best way to do it. I prefer the MRI, but just because it doesn't have radiation. But if you don't have access to an MRI scan, or you've already had one, go back and get it read for visceral fat. The problem is no doctors read it.
Mhm.
You'd have to work with a doctor in my medical practice to get it read. And but we advocate that this get. If I could get to Secretary Kennedy, RFK, I would tell him that he needs to cut off funding for medical school until they teach doctors about this deadly fat inside the abdomen, instead of this big ruse that's being played with cholesterol, which nobody gets better. And you don't have to go to medical school to know that. If you're listening today, ask yourself, has one person in your life gotten their cholesterol improved and it changed their whole life and improved their health? Never happens. It doesn't happen, but nobody gets rid of this visceral fat and their whole life doesn't completely change. So Kennedy, our Secretary of Health, needs to mandate it taught in medical school. And the curriculum of the U.S. medical schools, unfortunately, is taught all over the globe. Why it's taught all over the globe is crazy, because they don't teach what's really going to reverse
Mhm.
disease. But that's probably why too, because the systems in place, like in your country, in the Philippines, or where China,
Mhm.
South Korea, they all make money off healthcare. Canada, Mexico, it's the same way. Germany, and so if you reverse it, it's going to disrupt the apple cart. And the apple cart, don't tip the apple cart. It's the largest part of our economy in the United States is not oil or energy or commerce, it's
Mhm.
healthcare. And so if you teach this in medical school, you will disrupt the largest part of the economy and bring transformation, and humanity will forever be changed.
Absolutely. I 100% agree. So the beauty is that this is reversible. But so you mentioned how we reverse it, how we can help people to reverse. So you mentioned about lifestyle, um, diet, lifestyle. So what to do and how long does it take to reverse? And can we fully reverse it?
Yeah. So one thing, people want to know diet, lifestyle. This was an experiment we did. It's only been done one time in the history of the world. It's the only time it's been done, and I haven't been able to duplicate it yet. But it really should be formally studied. And this is where a single human being got scanned 6 times, and he only did one thing. He wouldn't do anything else. We wanted him to do a bunch of things for the National Science Foundation, but he was like 70 years old, and he was a curmudgeon, I call him. He was cranky. He said, "No, I'm not going to do that. I'm not going to do that. Nope, I'm not going to do that. The only thing I'm going to do is I'll cut out the processed foods, but I'm not exercising. I'm not doing anything else." So he did not exercise 1 minute. And this was him filled with visceral fat. We colored it red. His muscles were filled with visceral fat, also colored red. His subcu fat is yellow. And you can see in 2 weeks, Dr. Bahar and your followers can just visually see that in 2 weeks, he reduced his visceral fat in that let me just tip it a little bit, in that short period of time. And then by the time 35 weeks comes along, look how much he's reduced his visceral fat in 35 weeks. And he goes from having a big belly that sticks up when he's laying down to now looking like a college swimmer. He got a 6 pack. He got this nice, shape to him. And he's still 70 years old. And he did it without exercising 1 minute in 35 weeks. So what that means is this is what you need to do. You got to stop eating processed foods. And I'm telling you, the system doesn't want it out there. But this photograph, these series should be replicated. We should do a study of 1,000 people just cutting out processed foods, showing every one of them would get better like this. So first thing we do when clients come to work with us to become the healthiest version of themselves is we get them off processed foods. They can't eat anything that's processed. It's just all eating clean food in whole form. And we advocate eating meat, and then fermented vegetables is the fastest way of getting rid of visceral fat and fat around the heart. Just eating meat and regular fermented vegetables. If you eat regular vegetables, you still will get rid of it, but it just takes longer. And we just get better results with that ultimate elimination diet with just meat. And then the fermented vegetables are just to add the microbial benefit that comes from these living microbes inside of fermented food. So they're an extraordinarily different dietary strategy, not taught to us in medical school either, that contributes to our microbiome. And you're an OB doctor, aren't you?
No, I'm a family doctor.
Family practice. Well, you must know about the microbiome, and
Yes,
and
yes,
so
yes,
we're learning more about the microbiome. But
yes.
the one of the chief ways to contribute to the microbiome is by eating living foods that are fermented. I think Asian cultures do a much better job, definitely, than American cultures. I was first exposed to it in South Korea as a U.S. Army physician serving in South Korea, where the Koreans in traditional restaurants would go, crazy if we ate the meat and didn't eat the kimchi, because it violated their mores, their values. They had inculcated in them from their earliest existence the necessity to eat kimchi and other fermented vegetables whenever meat was being consumed. And so I've incorporated that into my strategy as well for my clients. And optimization of the microbiome is absolutely key. You've got to enrich your microbiome.
Absolutely, 100% again. Fermented food, probiotics and prebiotics, they do have that vegetable, garlic and onion, which is a great food for feeding that bacteria. It's amazing. So, apart from diet, do you recommend any medications or supplements in your regimen or?
No medications. Occasionally, if I have somebody that has a lot of inflammatory disease in their body, I will put them on some low dose naltrexone,
Mhm.
LDN.
Mhm.
So I think LDN is a good transition medicine to help reduce some of the suffering that people have. It's interesting to me also the fingerprints of big pharma. LDN is not taught in medical school. And one business fact: everybody's sort of a business person because you got to go buy stuff in the store. The fact that low dose naltrexone in very small dose is not being manufactured means that
Mhm.
big pharma doesn't want it out there, because when you give just a tiny bit of LDN, it really dramatically improves people, and that dries up the market. So I hope that Secretary Kennedy exposes the greedy, awful influence of big pharma within the FDA and gets the pharmaceutical industry. Or I'll just say, if I was Secretary Kenny, I'd say, screw you guys, you're done. I'll go get my buddy Elon Musk and we'll start a company and we'll make that LDN and prescribe it for 1.5 milligrams, in a
Mhm.
small dose, just a little whiff of it. So yeah, that's what needs to happen. I think smaller dose LDN is one prescription that I give. And I always tell people I'm an emergency medicine doctor. If you have a heart attack, I'm going to hit you with atropine, epinephrine. I'm going to stent you. I'm going to get you. That's what I would want done for me. I don't want somebody coming at me with a grass-fed steak when I'm ischemic and I'm hypotensive. I'm in
Yeah.
cardiogenic shock. Medicines have a role in an acute emergent situation, but
Yeah.
they don't have a role when it comes to prevention and reversion of disease. You need to change your life. That's how you reverse disease and prevent disease, by living healthier. So I also do recommend supplements. I like another one that is involved that shows the fingerprints of big pharma, which is NAC. NAC stands for N-acetylcysteine. NAC, NAC. So NAC is a supplement you can get in our country. Some countries, I think, make it harder to get, but it's a very safe medication. We used it a lot in the
Mhm.
ER. I don't like talking about how it was used because it's associated with certain things that people do we don't want them to do, but it's
Mhm.
how we save them. So NAC has this protective benefit, initially pharmacologically, on preventing toxicity to the liver. And so NAC would be used that way, but it's also very anti-inflammatory in small doses as well. So the FDA tried to ban it several years ago. There was such an uproar that they had to back away from it. And listen, it wasn't men and women inside the FDA that were like trying to protect Americans. It was men and women inside the FDA that wanted jobs with big pharma that were going to be waiting for them when they left their service of the FDA. And
Mhm.
so they tried to ban this supplement from Americans being able to access it. So when you see that happening, get on Amazon, buy it up. For a while, NAC was not being sold on Amazon or any of the major, consumer websites because of the influence and action by the FDA. And they hadn't quite banned it yet. So now it's back. Buy NAC. I recommend buy NAC. And I'm also a big believer in magnesium. I think we're, the average American, not sure what it's like in your population over there, but
Yeah.
the number one nutritional deficiency in our country is magnesium. So magnesium is safe to consume and supplement with, and so I recommend either magnesium glycinate or magnesium threonate to
Mhm.
take as a supplement and on a daily basis, because our food sources are so depleted of magnesium, and including our water sources. And so we no longer have access to it. And our gut microbiomes are
Mhm.
also play a significant role in the bioavailability or absorption to be able to utilize magnesium. And our microbiomes are a fraction of what they formerly were in older days, where we could be exposed to magnesium and just get it into our system a
Mhm.
lot easier. Today, with all the amount of disease and suboptimal microbiome within our gut, we just can't get enough. So I think it's essential. So I put all my clients on magnesium supplementation to take. I think it's really that critically important. And the last one that I also think is really worth taking, looking at, is lithium aspartate or lithium orotate. So this is just the mineral lithium, not the drug. There is a pharmacologic prescription form called lithium carbonate that they put people on with bipolar disorder and mood disorders to try out. But lithium, the mineral, attached to a little bit of orotate, which is a natural molecule, to allow it to be absorbed better. You can just take a little whiff of it, like 20 to 30 milligrams, just a tiny bit on a daily basis, is neuroprotective. So it helps protect your neurons, your cells within your brain. And so in one rat study that they did, 50 rats, 25 groups got the lithium, 25 didn't. And then they did it was a stroke model where they tied off the middle cerebral artery, which is the number one site of strokes
Mhm.
for humans having strokes, is most commonly the middle cerebral artery. So it's a great stroke model. They tied it off to cause the loss of blood flow, induce brain damage, and the rats that didn't get lithium were profoundly affected, very symptomatic, couldn't walk, couldn't feed, couldn't go through a maze, couldn't roll over or exercise. They had massive brain damage on their MRI scans. You could put a rat in an MRI scan and see the brain damage in its brain. And the rats that got, however, lithium had like almost no detectable MRI changes, no
Interesting.
ischemia on the MRI, and they had like no detectable change on physical exam. They were almost essentially normal. Imagine full ligation of a middle cerebral artery, and you took 6 weeks of lithium, and it's protective. So every one of my clients, I recommend go on lithium orotate. You can get it off Amazon. It's a natural mineral, and it's life changing in terms of its impact for depression, anxiety. It's been shown to reduce the incidence of dementia and cognitive decline. Very considerable, significant benefits from this mineral that again, they don't want you to know about.
Yes, it's amazing to know. So this image of the CT scan or MRI scan in your back, so that what took about 35 weeks, that progress and change or transformation. What about biomarkers? Do you check any biomarkers like A1C or liver tests?
I
And
used
how
to.
long does
They
it
they
take?
all they all improve when you get rid of visceral fat and
Mhm.
fat around your heart. So they're all downstream to visceral fat. So what I found is I've stopped testing the blood markers, blood lab values. I've done millions of dollars in blood studies
Mhm.
because they're all downstream and it's just a lot more relevant. So I have my client patients now spending money on MRI scans rather than blood work. And the other thing is sometimes, if you're just tracking there's so much variability. There's a dynamic aspect to these blood studies. If you repeat them even a week later, they can be different. And so you're scratching your head like, what's going on? You
Mhm.
never scratch your head when it comes to visceral fat. Okay. It's there and it just goes away as you live properly. So you don't have to worry about, is it up or down for some confounding reason? It always goes away when you do the right thing. and it always increases when you do the wrong thing. But sometimes glucose goes up, A1C, because you're eating a bunch of carbohydrates, and not same thing with insulin. Your insulin might go up because you eat too many carbohydrates, but sometimes glucose goes up because you're exercising, and your insulin can go up
Mhm.
because you're exercising. So it's too vulnerable to confounding. But visceral fat and heart fat, no confounding, always goes up when you do the wrong things and always goes down when you do the correct things.
Yes, and the sooner we see these images, the better. So we can start the reversal program.
Yeah, well, I hope you can incorporate it into your practice and start, look at all your
Yes.
patients' past CT scans and show them, well, the reason why you got these symptoms is look at you, 5 years ago, you had all this abdominal, visceral fat on your CT abdominal scan or your MRI scan. You can see these things, Dr. Bahar, and knee MRIs, shoulder MRIs, if people have had MRIs on their
Mhm.
thighs. My son just had one for an injury in the army, and I was super glad to see he had no muscle fat. It was just super pure muscle, very beautiful muscle. But it's ignored, by our colleagues in medicine because we're not
Yeah.
taught in medical school.
No.
Just I mean, do you in your
It's a
countries? Do you
reactive. It's
guys?
a reactive medicine. We're not proactive. It's just when disease strikes, then we want to treat. I mean, we're great conventional doctors. We're so good in acute medicine, but not chronic disease and prevention.
Yep.
That's the big problem.
Yep, that's really a big problem, and
Yes.
we need to have, and if the medical schools and physicians won't do it, we'll start a new profession out there.
Yeah.
Health optimizing professionals that get medical training,
Mhm.
science, and eliminate disease, not make money, with sick care, like you said earlier.
Yeah, exactly. So, what are the three things that if someone today wants to start reversing visceral fat, three immediate things that you recommend as our last words or parting words?
Yeah, so I definitely recommend the what I call the living carnivore diet. So meat and ferments, getting time out in sunshine, and a sauna and cold plunge, and sprinting. Those things will completely change your life. But people, it's been my experience, Dr. Bahar, that they won't do it. They
Mm-hmm.
don't do it unless they see that disease. So
Yeah.
investigate getting an MRI scan in your country, wherever you are listening. We do, by the way, international consultations with people, and we'll read
Mhm.
their scan if they can get a scan, for and we can help them. If they go to my website, growingbetternotolder.com, growingbetternotolder.com, they can get a consultation through our medical practice, and we'll work with them through a 2-month program to eliminate that visceral fat, read their MRI scan. We do a really nice job with doing a video report for them. And if anybody's listening and they can come to the United States and come see my practice, they can come see me. My medical practice has a different website if you want to work directly with us one-on-one. DrSeanOmara.com, 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 to work with me one-on-one or one of my physician partners. And the third way is just hang out with people in an online program. I call it my tribe, who are all getting rid of visceral fat, and we talk about it
Mhm.
in a weekly program we do twice a week, 1 hour, called Alpha Maker. And you can go join the Alpha Maker program. And there's um, people in there that all over the world trying to get rid of visceral fat, muscle fat, and heart fat. And it's the same website, growingbetternotolder.com. /alpha, ALPHA dash maker. And so you can go and join Alpha Maker, and you'll have access to me because I run that program, and you can ask questions because they're live. You can ask questions of me twice a week. So it's a great group, great community, great tribe of people, all doing these things and a whole lot
Mhm.
more to get
Of
rid of this
course.
dangerous fat.
Of course. Amazing. It was lovely having you here today and hopefully meet you soon.
All right. Thank
Again,
you, Dr. Barr.
thank
Appreciate your
you. Thanks
opportunity to
everyone being here and see you soon. Bye.